My name is Franjo Grotenhermen. I am a medical doctor and a scientist. Due to a chronic illness, for which I do not take cannabis, I had to end my work as a hospital doctor 28 years ago. For 25 years, I have now been working on the pharmacology and toxicology of cannabis and cannabinoids, as well as their therapeutic potential. In 2000, I co-founded the ICM, the International Association for Cannabinoid Medicines. In 2012, I opened a medical practice that focuses on the use of cannabis and cannabis-based medicines. In my medical practice, I see how many seriously ill people benefit from a treatment with cannabis-based medicines. The spectrum of diseases ranges from chronic pain of various origins to chronic inflammatory diseases, from neurological disorders to diseases associated with loss of appetite or nausea, from psychiatric conditions to many other medical conditions. The experienced effectiveness in different symptoms or medical conditions does not necessarily reflect the limited published scientific knowledge. My patients who suffer from otherwise refractory symptoms and benefit from cannabis have more than 50 different diseases. The broad spectrum of cannabis effectiveness is easily understandable when one considers the nature of the endogenous cannabinoid system with its receptors and endogenous ligands. Activation of the endocannabinoid system inhibits the overactivity of many other neurotransmitters. The endocannabinoid system is found throughout the body, in the central nervous system, the gastrointestinal tract, the respiratory tract, the reproductive system, the immune system, the skin, the bones, and the cardiovascular system. There are even diseases associated with reduced or enhanced activity of this system. The therapeutic modulation of this unique system cannot be replaced by the modulation of others. Every day, I experience the gratitude of patients who finally find relief for the first time after a long and difficult journey, or who are finally allowed to use their medicine legally without fear of prosecution. Many patients know more about the efficacy of cannabis medicines in their condition than most doctors and scientists. This causes a credibility problem. If a patient experiences the efficacy of cannabis in his or her illness, but does not receive the support of doctors due to lack of knowledge, then the medical profession has a credibility problem. When self-help groups find that scientific evidence does not reflect their members' experiences, then science has a credibility problem. If lawmakers and other state institutions deny access to a medicine that helps many seriously ill people, then governments and other state institutions have a credibility problem. Today, in the 21st century, the debate about cannabis as a medicine is mainly about two issues. First, research efforts on the therapeutic potential of cannabis and cannabinoids have already proven its safety and efficacy in randomized clinical trials. But this needs to be intensified so that physicians can work on an even more solid basis. Second, there is no longer a viable argument as to why patients who, according to a medical doctor, profit from cannabis medicines should be prosecuted. They need access to such products, and doctors must be able to advise and treat them. The question of cannabis as medicine is not so much about a drug as about two basic principles of a civilized society. The first principle is that patients should receive the best possible therapy. It is the great advantage of a cannabis-based treatment that such a therapy does not fail due to economic concerns. Cannabis can be supplied for a reasonable price. The second principle is that doctors, scientists, and government institutions should work for the benefit of the citizens. Only then can they fulfill their duty. Only then can they retain or restore their credibility. We should not forget that the narcotics laws of the countries around the world and the international drug treaties were created to protect people from the dangers of narcotics. They were not created to harm sick people. Please open another treatment option to many seriously ill people. Please help physicians help their patients. Please help scientists do their work. Thank you.